Okay, today I'm going to be doing a secondary bag called a piggyback off of our primary bag, which is currently running vancomycin. And this medication is going to be Zosyn. The doctor ordered it to treat an infection. He had something going on with his GI system. So we're going to give him some Zosyn. It's going to be 250 milligrams and 50 mils of normal saline, 0.9% sodium chloride to infuse over 1 hour at 9 drops per minute. And there's my mask right there, along with the rest of my med card. And we're going to watch his white blood cell count. We're going to look for diarrhea, constipation, runny nose, sneezing, white patches or sores in the mouth because it can cause thrush, irritation on the skin, stomach upset, hiccups, headache, fever, and sweating. And he's going to have some stomach and bladder pain, hopefully not, bloating, swelling of the face, arms, hands, lower legs, feet. He might have some chest pain, which is a really adverse reaction. We're going to watch for his vision and hearing, make sure they don't have any issues there. And he might have some unexplained weight loss or some tingling or numbness. We're not going to want to continue this if that happens. Those are all adverse reactions. Okay, I'm in the med room. I've washed my hands. I've got my medication bottle, which is my Zosyn. My date's good, and it says for 200, it's 3 mils. It's 250 milligrams. So I got my needle and my syringe, which is a 3 mil syringe. I'm going to attach my needle, pull out my needle, draw 3 mils of air. I'm going to anchor my bottle, carefully inject my air, flip it upside down. I'm going to draw up 3 mils of solution of my med. There we go, 3 mils. No air bubbles, which is good. Ooh, got an air bubble. I'll flip that back over. Make sure that's 3 mils. There we go. 3 mils. I'll draw that out. Recap my needle. Okay. And my bag is actually a needled bag, so if it was needleless, I would take a blunt cannula, a needleless attachment device to puncture my bag and administer my med. So I've got my med drawn up with the needle. I got it, the bottle, and my MAR and my med card. There we go. Okay. I also am going to need a medication label, which is already labeled with my patient name, the room number, the drug, the amount, who did it, the solution, which is normal saline, the date I started it, the date that it was administered, the time that it was put in, what time it's going to start, the flow rate, and the time we're going to expect it to end, which is 1 hour. And I got my bag here. I'm going to go ahead, hang this up. Nope, not in the patient room yet. So, got everything together. We're going to go to the patient room. Okay, knock knock. Hi, how are you? My name's Dawson. I'm going to be hanging a med on your IV today. It's to treat some infection. It's called Zosyn. We're going to hang it off of your existing IV site with your bag already running, okay? Can you give me your name and your date of birth? Okay, thank you. Still no allergies? Awesome. Alright, just give me a minute. I'm going to get everything mixed up and we'll get the procedure over and done with, as long as you cooperate with me, okay? Okay. I'm going to open up my bag. It's good. The expiration date's still good. That can go in the trash. I got my med. Going to double check. 3 mils. 250 milligrams, 3 mils. Zosyn is my order. Going to decap my needle. Very gently insert it into the connection port without puncturing my bag, and slowly push my med. Oop. Needs to go in a little farther. There we go. Slowly pushing in my med. And I'm going to very gently remove that, and this would go in the sharps. In the sharps, there it is. Alright, going to wiggle my bag a little, get that medicine moved in there good. And now I'm going to attach my label to my bag. There we go. All good. Got my set. I'm going to open up my set. Got my hanging bag. Gonna use that in just a second. Got the actual administration set. Gonna open it up. Okay, it's a short little set because it's going to be attaching. I'm going to have my bag in my hand. I'm going to pop off my tab. Undo that. Puncture my bag. Tilt it up. And it's running. Going to clamp that. And I'm going to attach this so it can run in. Because if they're at the same height, they're not going to run in right. So we're going to attach that. There we go. I'm just going to let that dangle for a minute. I still got the cap on the end. Okay. Now, I'm going to wash my hands really good. Put gloves on. And I've filled my tubing already. I got it ready. I got my alcohol pad. And I'm going to identify my patient again just to make sure. Okay, can you tell me your name one more time? Good. And what's your birthday? Still no allergies? Awesome. Okay. And now I'm going to check my IV site while I'm opening up my alcohol pad. It's good. Does this hurt? No. There's no heat. It's not tender. It doesn't look like it's infiltrating. And it's flowing good from the bag that's already hanging. Okay, since that's ready, I'm going to bring my IV pole a little closer so I can use it. Gonna take off the cap, grab this in my hand. I'm gonna clean my sites. Okay, all good. Now I'm going to attach it. There we go. And since it's hanging lower on the pole, I'm going to go ahead and unroll that. And there we go. I'm going to observe my chamber for 1 minute to make sure it's dropping at 9 drops per minute. And as long as it's right there around 9, 10, it will be fine. It'll run throughout our hour, and it's running good. Okay. It's unclamped. It's lower than the other chamber, so it's dropping good. It's been a minute. It's dropping at 9 drops per minute. And now I'm going to I'm just going to watch the infusion site for a second. It's still fine. Now I'm going to come back over the next hour, definitely in 15 minutes. Make sure there's no reaction going on or anything. Make sure he's tolerating the meds well. And now now I'm going to dispose of my needleless devices. Going to throw away everything in the appropriate bins, and then I'm going to document the medication I administered on the MAR, which was Zosyn, 250 milligrams, 3 mils, in a 50 ml bag, running for an hour. Started at 1:30, and going to state my condition in my IV site. I'm going to record the volume of the fluid he intook and make sure he's okay over the next hour. Come back about an hour, double check it, make sure they're running good, and they should be empty by that point. I'm going to disconnect them and document everything well. And that was a piggyback med.